Does intestinal obstruction cause bloating and gas? Have you ever wondered if intestinal obstruction could be the reason behind your bloating and gas? It is a common concern for many, especially those dealing with sensitive stomach issues. Let's break this down together. Intestinal obstruction occurs when there is a blockage in the intestines. This blockage prevents the normal passage of digestive contents. When this happens, gas and fluids build up behind the obstruction. This buildup can lead to an uncomfortable feeling of fullness or bloating in the abdomen. The symptoms of intestinal obstruction are quite telling. You may experience abdominal bloating, cramping, or intermittent pain. Some people find they cannot pass gas or have bowel movements. Nausea and vomiting can also occur, along with a loss of appetite. The key to understanding these symptoms is that the bloating results from gas and fluids that cannot move past the blockage. For those with a sensitive stomach, such as individuals with irritable bowel syndrome or colitis, the experience of bloating and gas can overlap with symptoms of intestinal obstruction. However, the causes are different. Irritable bowel syndrome and colitis often lead to bloating and gas due to inflammation or sensitivity to certain foods, without any physical blockage. That said, if someone with irritable bowel syndrome or colitis develops an intestinal obstruction, it can worsen their symptoms. This may happen due to severe inflammation, narrowed areas in the intestines, or scar tissue. In these cases, bloating and gas can become more pronounced, along with additional symptoms like severe pain and vomiting. Managing bloating and gas in sensitive stomach conditions requires careful monitoring. If you notice persistent bloating that worsens, or if it is accompanied by severe pain, vomiting, or an inability to pass gas or stool, it is essential to seek medical evaluation. Unlike typical bloating from irritable bowel syndrome or colitis, obstruction symptoms do not resolve quickly and can become serious if left untreated. In summary, intestinal obstruction does indeed cause bloating and gas due to trapped contents and impaired passage through the intestines. While bloating and gas are common in irritable bowel syndrome and colitis, obstruction is a more serious condition that requires prompt medical attention. Understanding these differences can help you recognize when to seek help and manage your symptoms effectively.